You're 65 years old, sitting in your living room watching television. Your spouse is out visiting a friend. Suddenly, you feel a crushing pain in your chest that radiates down your left arm. You're sweating, you can't catch your breath, and a wave of terror washes over you because you know exactly what this is. You're having a heart attack and you're completely alone. What you do in the next few minutes could be the difference between life and death. And here's the terrifying truth. Most people over 60 do exactly the wrong things in this situation, and it costs them their lives. Stay with me, because I'm about to share 8 critical steps that every senior needs to know to survive a heart attack when help isn't immediately available. This isn't just information. This is a survival guide that I pray you never need. But if you do, it could save your life or the life of someone you love. And before you think this won't happen to me, consider this. Someone over 60 has a heart attack every 40 seconds in this country, and nearly a quarter of them happen when the person is alone. Now, I need to be crystal clear about something before we go any further. What I'm about to share is not a substitute for calling emergency services. Nothing I say should make you think you can handle a heart attack on your own without medical help. But the reality is that help takes time to arrive. The average ambulance response time in urban areas is 7 to 14 minutes, and in rural areas, it can be 30 minutes or more. Those minutes between when symptoms start and when paramedics arrive are absolutely critical. And what you do during that window can mean the difference between surviving with minimal heart damage or dying before help arrives. So everything I'm about to tell you is about maximizing your chances of survival until professional help reaches you. Let me start by addressing something that kills more heart attack victims than almost anything else: denial. The first and most important tip for surviving a heart attack alone after 60 is to recognize that you're having a heart attack and take it seriously immediately. This sounds obvious, but study after study shows that people, especially seniors, wait an average of 3 to 5 hours before seeking help for heart attack symptoms. 3 to 5 hours. Why? Because they convince themselves it's something else. It's just indigestion. It's just stress. It's just a pulled muscle. I'll wait and see if it gets better. Maybe I should take a nap. This deadly delay is even more common in people over 60 because heart attack symptoms can be more subtle than the dramatic chest-clutching collapse you see in movies. Here's what you absolutely must understand. Heart attack symptoms in people over 60 are often different from the classic symptoms. Yes, some people get the crushing chest pain, the left arm pain, the classic presentation, but many seniors, especially women, experience what doctors call atypical symptoms: unusual fatigue that comes on suddenly, shortness of breath without chest pain, jaw pain or tooth pain, upper back pain between the shoulder blades, nausea and vomiting, dizziness or lightheadedness, breaking out in a cold sweat for no reason, pain that starts in the upper abdomen and feels like really bad indigestion. Some people just feel a sense of impending doom, an inexplicable feeling that something is terribly wrong. If you're over 60 and you experience any combination of these symptoms, especially if they come on suddenly and feel different from anything you've experienced before, you need to assume it's a heart attack until proven otherwise. Don't wait to see if it gets better. Don't try to tough it out. Don't worry about being embarrassed if it turns out to be nothing. I cannot stress this enough. Every minute that passes during a heart attack, heart muscle is dying. There's a saying in emergency medicine: time is muscle. The faster you get treatment, the more of your heart muscle can be saved, and the better your chances of survival and recovery. So that brings us to the second life-saving tip. And this is where many people make a fatal mistake. Call 911 immediately. Don't call your doctor. Don't call your children. Don't call a neighbor to drive you to the hospital. Call 911 first, before anything else. Here's why this is so critical. When you call 911, several things happen that dramatically improve your survival chances. First, the ambulance is dispatched immediately and they're coming to you. You don't have to worry about driving or getting to the hospital. Second, And this is crucial. Paramedics in the ambulance can start treating you right away. They can give you oxygen, aspirin, nitroglycerin, and other medications. They can do an EKG to confirm you're having a heart attack. They can monitor your heart rhythm and shock you if you go into a deadly arrhythmia. Third, when an ambulance brings a heart attack patient to the hospital, the emergency room is already preparing for your arrival. The cardiac catheterization lab is being activated. The cardiologist is being called in. You bypass the normal emergency room wait and go straight to life-saving treatment. Compare that to what happens if you call your neighbor to drive you, or worse, try to drive yourself. You might pass out while driving and kill yourself and others in a car accident. Even if you make it to the hospital, you'll be treated like any other walk-in patient. You'll have to check in, wait to be triaged, wait to be seen, and precious minutes or hours could be lost. And if your heart stops, you're in a car with no medical equipment and no one trained to save you. The statistics are stark. Heart attack patients who arrive by ambulance have significantly better survival rates than those who are driven by friends or family. Now, when you call 911, here's exactly what you need to say. And this is the third tip. Clearly state, "I think I'm having a heart attack." Give your exact address, including apartment number if applicable. Mention your age and tell them you're alone. Don't downplay it. Don't say, "I'm not sure, but I'm having chest pain." Be direct and clear. The dispatcher will ask you questions and give you instructions. Follow them exactly. They might tell you to unlock your front door so paramedics can get in even if you lose consciousness. They might tell you to lie down. They might tell you to take aspirin if you have it. Listen and do what they say. Keep the dispatcher on the line until the ambulance arrives. If you collapse or pass out, at least they'll know and can make sure the paramedics get inside to find you. Here's the fourth critical tip. This one is incredibly important. Take aspirin immediately if you have it and you're not allergic to it. Aspirin is one of the most powerful emergency treatments for a heart attack, and you can give it to yourself. The moment you suspect you're having a heart attack and have called 911, chew and swallow a regular aspirin, either one regular 325 milligrams aspirin, or for baby aspirins totaling about 325 milligrams. Chew it, don't swallow it whole, because chewing gets it into your bloodstream faster. Aspirin works by preventing your blood from clotting, which can help prevent the clot blocking your coronary artery from getting bigger and causing more heart damage. Studies have shown that taking aspirin during a heart attack can reduce mortality by about 23%. That's huge. Think about that. Something as simple and cheap as an aspirin. Something most people have in their medicine cabinet can reduce your chance of dying by nearly a quarter. But here are the critical caveats. Only take aspirin if you're not allergic to it. If you're not already on blood thinners, that would make aspirin dangerous. And if you don't have active bleeding or a bleeding disorder. If you're on medications like warfarin or Eliquis, or if you have a history of stomach ulcers or bleeding problems, aspirin could be dangerous. When in doubt, ask the 911 dispatcher if you should take aspirin based on your medications. But for most people, aspirin is safe and could save your life. The fifth tip is about positioning yourself for survival. And this is something most people don't know. Sit down in a comfortable position. Preferably on the floor with your back against a wall or couch or in a sturdy chair. Do not lie flat on your back. Why? Because if you're having a heart attack and you're short of breath, lying flat makes it harder to breathe. Sitting upright or semi-reclined makes it easier for your lungs to work. Also, if you're sitting on the floor, you won't fall if you lose consciousness. Falling during a heart attack can cause head injuries or broken bones that complicate your treatment and recovery. Many elderly people who survive the heart attack itself die or are permanently disabled from complications of a fall during the heart attack. Position yourself somewhere the paramedics will easily find you. If you're in a multi-story house, get to the ground floor near the front door if possible. If you can't make it that far, at least get to a location where you'll be visible and accessible. Don't lock yourself in a bathroom. Don't stay upstairs if you can safely get downstairs. You want to make it as easy as possible for paramedics to reach you quickly when they arrive. Now, here's the sixth tip. And this is something that circulates in viral emails and social media posts, but is often presented incorrectly. Focus on staying calm and breathing steadily. You may have seen posts about cough CPR, the idea that you can save yourself from a heart attack by coughing forcefully and repeatedly. Let me be absolutely clear. Cough CPR does not work for heart attacks, and major medical organizations, including the American Heart Association, have debunked it. It's based on a misunderstanding of a technique that's sometimes used in very specific hospital settings under medical supervision. If you waste time and energy doing cough CPR instead of calling 911 and taking aspirin, you're actually hurting your chances of survival. What does help is staying as calm as possible and breathing steadily. I know that's incredibly difficult when you're terrified and in pain, but panic makes everything worse. When you panic, your heart rate increases. Your blood pressure goes up, and your heart needs more oxygen, exactly what you can't afford during a heart attack. When your heart isn't getting enough oxygen already, try to focus on slow, deep breaths. In through your nose, out through your mouth. This won't stop the heart attack, but it can help prevent dangerous heart rhythms and keep you conscious until help arrives. If you know any meditation or relaxation techniques, this is the time to use them. The seventh tip is absolutely crucial and could make the difference between permanent disability and full recovery. If you have nitroglycerin prescribed to you, take it as directed. Many people over 60 who have known heart disease or angina have nitroglycerin tablets or spray prescribed for chest pain. If you're one of these people, take your nitroglycerin. The typical instruction is 1 tablet under your tongue. Wait 5 minutes, and if the pain isn't better, take another one, up to 3 tablets total. Nitroglycerin works by dilating your blood vessels, which can improve blood flow to your heart and reduce the workload on your heart. However, and this is critical, do not take nitroglycerin if you've taken Viagra, Cialis, or similar medications for erectile dysfunction in the past 24 to 48 hours. The combination can cause a catastrophic drop in blood pressure that could kill you. Also, tell the 911 dispatcher that you're taking nitroglycerin so they can inform the paramedics. When paramedics arrive, immediately tell them if you've taken nitroglycerin and how many doses. This information is crucial for their treatment decisions. If you don't have prescribed nitroglycerin, don't take someone else's. Don't go searching through your medicine cabinet for old medications. Focus on the aspirin, calling 911, and staying calm. Nitroglycerin is only for people who already have it prescribed for their own use. Now we come to the eighth and final tip, and this one is about what not to do. Because the wrong actions can kill you just as surely as doing nothing. Do not try to drive yourself to the hospital. Do not eat or drink anything. Do not take any other medications without asking the 911 dispatcher first, and do not lie down flat or go to sleep. Let me explain why each of these is dangerous. Driving yourself seems logical. You want to get to the hospital fast, but you could lose consciousness, have a cardiac arrest, or become too impaired to drive safely, and then you're in a car accident on top of having a heart attack. You could kill yourself and innocent people. Just don't do it. Even if you live 5 minutes from a hospital, even if you think you're okay to drive, you're not. Your judgment is impaired by the heart attack, the pain, the fear, and the lack of oxygen to your brain. Not eating or drinking is important because if you need emergency surgery or procedures, having food or liquid in your stomach increases the risk of aspiration, vomiting, and inhaling the contents into your lungs, which can be fatal. The cardiologists might need to do an emergency catheterization or surgery within minutes of your arrival, and they can't wait for your stomach to empty. Don't take other medications unless the 911 dispatcher specifically tells you to. Some medications can interact dangerously with the treatments paramedics will give you. The only medication you should take on your own is aspirin, and even then, only if you're not on blood thinners and not allergic. And finally, don't lie flat and don't let yourself fall asleep, no matter how tired you feel. Lying flat makes breathing harder and can worsen heart failure. Falling asleep is dangerous because you might be losing consciousness, not just sleeping. And you need to be awake to talk to the 911 dispatcher and give information to the paramedics when they arrive. The feeling of extreme fatigue during a heart attack is your body shutting down. Fight it. Stay awake and stay sitting up until help arrives. Let me put all of this together into a clear action plan, because in the stress and fear of an actual heart attack, you need to remember the steps. First, recognize the symptoms and don't deny what's happening. Second, immediately call 911 and clearly state you're having a heart attack. Third, take aspirin if you have it and aren't allergic. Fourth, sit down in a safe, accessible position. Fifth, stay calm and breathe steadily. Sixth, take nitroglycerin if it's prescribed to you. Seventh, avoid the dangerous mistakes. Don't drive, don't eat, don't take random medications. Don't lie flat. And throughout all of this, stay on the phone with a 911 dispatcher and follow their instructions. Now, I want to address something important. Everything I've just told you is about surviving when you're alone. But the best strategy is to not be alone in the first place, especially if you're at high risk for heart attack. If you're over 60 with risk factors like high blood pressure, diabetes, high cholesterol, smoking history, family history of heart disease, or previous heart problems, consider getting a medical alert system. These are devices you wear as a pendant or bracelet that you can press to immediately call for help. They cost anywhere from $20 to $50 a month, and they can summon emergency services even if you can't get to a phone or are too impaired to dial. Also, make sure people check on you regularly. Whether it's a daily phone call from a family member, a friend who stops by, or a neighbor who knows to check if they don't see you, having people who notice if something is wrong can save your life. Some seniors have arrangements where they call a friend at the same time every day. And if the call doesn't come, the friend checks on them. Keep your medical information easily accessible. Have a list of your medications, allergies, and medical conditions on your refrigerator or by your front door. Paramedics are trained to look in these locations. When every second counts, not having to search for this information could make a critical difference in your care. Finally, know your risk factors and work with your doctor to reduce them. Am I telling you that eating right and exercising will prevent all heart attacks? No, of course not. Sometimes genetics and bad luck trump everything else. But controlling high blood pressure, managing diabetes, taking cholesterol medication if prescribed, stopping smoking, maintaining a healthy weight, these things really do reduce your risk. The best heart attack to survive is the one that never happens. I want to close with this thought. If you're watching this and you're over 60, please share this information with your friends, your spouse, your siblings, anyone who might need it. Better yet, sit down with the people you love and actually talk through what to do in this scenario. I know it's uncomfortable. Nobody wants to think about heart attacks and emergencies. But having this conversation, maybe even practicing where you'd sit, where your aspirin is, making sure you know how to unlock your door quickly, these little preparations could save your life. And if you're younger and you're watching this thinking about your parents or grandparents, have this conversation with them. Make sure they know these steps. Help them get a medical alert system if they need one.